Hello, this is Marta Calvo, and I'm going to talk to you about medicinal cannabis in veterinary medicine. I'm a veterinarian. I'm from Spain, but I've been living in Australia now for 5.5 years. I've been working as a holistic animal naturopath for many years, and I've been working and using natural therapies to help animals and to try to reach the best goal for them. Nowadays, I'm working with Connect Veterinary, and I'm the veterinary clinical educator, and I'm trying to help you all to understand what medicinal cannabis is, how it works, what can it do for the animals, and how can it help with the welfare of all of them. First of all, I would like to let you know that what we're talking about is medicinal cannabis. It means that we're really talking about products that are continuously and very thoroughly controlled. We are using raw products that have been assessed and have been tested before we use them. And we are not talking about marijuana, about smoking, about illegal products. We are really talking about very futuristic products, very controlled, and products that they're handled by experienced people that knows what really is doing, and that comes with a lot of research and background in the use of medicinal cannabis. And I would like to introduce a little bit of the story of the medicine in animals, specifically in animals, because I'm sure that many of you must think that maybe this is a new fashion, maybe this is something that we are just recently talking about it. And you might think that that's something that is going to disappear within a few years, because it's just something that everybody's talking about it, but it's going to be here with us for just a few years. Let me tell you, first of all, that the history of cannabis in animals starts long ago. We can go even to the Chinese moments with 2700, or maybe in Egypt or in India. We can even talk about the ancient Greek text. And in those times, they were already using and they're already describing the use of cannabis for animals. At that point, it was maybe and mainly for cattle, but as time went by, they started using it on some other animals, animals like dogs and horses. It was just until recently, last 60 years, that thanks to Raphael Mechoulam, which is nowadays known as the father of the medicinal cannabis, he was the one who was able to not only discover, but be able to really establish the formula and the activity of the THC first, and a little bit later of the CBD, that we started to think that there was something else within the body, a new system that we didn't really know how it worked. But by 1990, it was finally established, the endocannabinoid system within the bodies, and that it was really working and how it was interacting with other systems. We have to say that it has been just in those 60 years that we have started to understand all the combinations and all the products that are working within the endocannabinoid system. And it's not only about THC and CBD, plus some endocannabinoids that we do have inside our bodies that do interact into or do work into this system, and allow us and allow all the bodies to have different effects in different parts of our body. Just to point out regarding animals again, that in the 19th century, it was very, very used for by vets, especially in horses, mainly in horses, as an analgesic, as an hypnotic, as to calm down seizures for tetanus, but also in dogs and in cats. And in dogs, it was mainly used besides seizures, also to calm down coughs and yeah, for ear infections. So it's been since 19th century, as I said, widely used in animals. And more recently, in the 20th century, it was also used as a narcotic in some surgeries, and it was even used for infections like in pneumonia or in ear infections. So as you can see, it's not just something recently, it's not just something that is showing up now and that is a fashion. It was used for many, many years before. um, like in 1886, and that's important because it was already, and we are again talking in the 19th century, it was already used and it was described as very, very useful in dogs to reduce spasms, some seizures, something that maybe we can relate with epileptic problems, epileptic issues in dogs nowadays. And it was a little bit later in 1904, in 20th century, when this veterinarian over here, Muir, was able to establish doses and ranges and therapy doses for dogs and horses. And we are talking over 100 years ago. So it was really a useful product. It was probably one of the products that was mostly or mainly used as a medicine. It was really the most prescribed product in the United States. And there were even patented products for dogs and for horses, as you can see in here. This is a very, very nice photo of some of the products that they used in those times. But that show us that they were really, really used and that they were products that were, as I said, used daily on a daily basis for different problems, for different issues, not only for animals, also for humans. But yeah, they were really very interesting products. So let's talk a little bit about the endocannabinoid system, what it does, how it works, what are the components that it really has, and why so new, and how does it work in the animal's body. The first thing that we have to say is that we do know that the endocannabinoid system has, first of all, the endocannabinoids that do react with some receptors that we do have in the body in different structures in the cells. And there are also some enzymes that do allow to do different things with those products, to transport them or hydrolyze them, different things. So because we do have these three components, we are able to say that there is a system within our bodies which is called the endocannabinoid system. And now we are talking about endocannabinoids all the time. So how does it matches with cannabis? The point is that the phytocannabinoids that do come from the cannabis plant are capable and do work very similar to our endocannabinoids. And they're able to join and interact with those receptors. But what does the endocannabinoid system do? The main thing, and that's something really, really important to keep in mind, is that it promotes balance. It promotes homeostasis within the entire body. So it does help to balance any problem, even if it's like a hyper issue or if it's that we have low levels or any sort. So it does help to maintain that that way of working for the system all the time. It does activate when it's needed. It's not there all the time. I think that's pretty smart and very interesting, because in that way we are not overusing it. It's only activated when we need it, and it's mainly activated obviously under stress of any time. It doesn't matter if it's psychological or physiological stress. That's what it makes the endocannabinoid system to start working out. And we know how bad stress is for the body and how it really does control all the system, all the body, and how it can take us to get really sick for different reasons. So we can say that the endocannabinoid system is really, really important in that sense. We have to say that it does exist in all vertebrates and many of the invertebrates too. It's a very, very complex system, as we are just in the infancy at the moment with this endocannabinoid system, and we are just learning daily new things and new ways about it. And the reason why we say it's a super complex system is because there are so many receptors that at the moment they are not named as endocannabinoid system. And there are so many molecules that at the moment they're not recognized as endocannabinoids molecules, but they still interact with each other. And not only with each other, but they also work on some other molecules like the glutamate, like the GABA neurotransmitters, that at the end is so complex that as I said, we are just starting to understand it. And I think that that's the main reason why it wasn't recognized until recently, because it really works with so many aspects that no one realized that it was there. Another thing, and that's very interesting, is that it works as a retrograde neurotransmission control. What it means is that usually um, most of the neurotransmitters goes from the presynaptic neuron and they go to interact with the postsynaptic neuron. But in that case, the endocannabinoid system works in a retrograde way. So it starts on the postsynaptical neuron and it comes all the way back to the presynaptic neuron to stop or to control what is happening and what is going on that first presynaptic neuron. That's important to understand, and we'll go over it a little bit later. But it shows how complex it is and how important it is to understand exactly what is going on. We also can say that in 1992, Professor DiMarzo, and that's been widely used from that moment onwards, he said that the endocannabinoid system is mainly control system for the relax, the eating, sleeping, forgetting or reminding, and protecting. That's mainly all what the body, what the system needs to do, because it feeds and it grows from the eating. It needs to relax and calm down and sleep in order to be able to balance and to settle. And the forgetting is part of protecting too, because if we keep all the time all what we have in mind, by the end of our life we would be completely crazy. So the way that it works, letting us forgetting some of the memories or some of the things that we have in our mind and remembering some other is also a way of protecting. But it goes farther, because when we say that it protects, it's because it interacts so close to the immunity system, that we'll see how much it can enhance it and how much it can help our body to be able, to protect against exterior problems, either bacterial, viruses, or even when we think on our own body, like cancer, oncology issues, we'll see how much it can help us protect ourselves. So we can say that the endocannabinoid system is a new system within the body, but I would say that it is the system of the body. It really does help to control all of them, and it really does help to coordinate all of them. It helps with the sleeping regulation. It helps with the appetite, with the digestion, with thermoregulations. It helps control inflammation and pain by controlling, as I said, the neurotransmitters that are released in the neurons. It does help with the immune system, memory, neuroprotection, and of course, it does help with the first stages of development of the body. So even in the first steps, like in the embryo, it is also in there, and it does help in controlling and regulating all of that. Is so important, and I just want to give a little tiny tip of knowledge regarding how far it can go, that it gets to control some of the essential biological process. And when we talk about essential biological process, we mean what is going to happen with the cells. It's able to go to the really inner part of the cells, and it really helps to control, or it really helps to maintain a balance again between the proliferation of cells, the differentiation of the cells, and therefore it does help the cell to choose whether it's going to survive or to die. And we are talking about apoptosis and what it really means, especially when we are talking about, again, cancer and oncology issues, and how far the cannabinoid system can go deep into the cells and help to control all those problems. So let's get a little bit into it, and let's talk a little bit of what do we have here. And we have what we call cannabinoids, but as I said before, we have endocannabinoids, which belong to our system. They are inside of our bodies, and we produce them as we need. The main ones, not the main ones, but probably the ones that were first recognized, and yeah, we can say that they're the main ones, but in that sense, are the anandamide, which is recognized as ANA, and the 2-AG, or 2-arachidonylglycerol. And those are the main endocannabinoids that we have in our body, but we do have some others that do react with the endocannabinoid receptors. Secondly, we do have the fetal cannabinoids, and those are the ones that we are mainly discussing nowadays. What are we going to do with them? How do they work? How do we use them? And those are the ones that comes from plants, mainly from cannabis, but not only from cannabis. There are some other plants that do have some phytocannabinoids, and there are more than THC and CBD compounds that are cannabinoids. And also, when we are talking about plants, especially cannabis, we have seen that it's not only cannabinoids products that do have an effect on the endocannabinoid system. We have seen that there are also terpenoids, flavonoids, which are in charge of the smell and the color of the plants, of the flowers. That is the main part that is used, that do also have an action, and that they do interact within the endocannabinoid system along with the cannabinoids, with the proper cannabinoids, and they do help to have some benefits. And finally, we do have what we call the synthetic cannabinoids, like dronabinol or nabilon. Those are the ones that obviously have been made up in the labs. They are not natural, but nowadays they've been used for some meds, and in the future days we will probably see some more coming up and starting to be introduced and used. Now, let's talk a little bit about the endocannabinoids and what they mainly do. And that's very interesting because we were talking about using cannabinoids or the use of cannabinoids to balance when we are stressed. This molecule, the anandamide, is known as the happiness molecule. And the reason mainly is because, yes, it does help or it does help to control that stress and that anxiety. And it helps us to calm down a little bit and to feel better and to feel happy. So it's very interesting that that molecule, which is in our body, it's not that we are having anything from outside. At the moment, it's not CBD, it's not THC, it's in our system, and it's still known as the happiness molecule. Um, this molecule is capable to interact with receptors Cv1 and Cv2. Um, as it is the happiness molecule, it does regulate the appetite and it responds to it. And it does help regulate the pleasure, the reward, all what makes us feel better. And it's very, very interesting because it does help to balance the all the hormones within to the reproductive system. And that's a part very, very interesting. We know that usually when the females, the women, and I think that it also happens in animals when they're pregnant, they feel more beautiful, they feel more happy, and they look more happy. So that's something that has to see also with endocannabinoids. And then the second molecule, which is the 2-AG, it also interacts with Cb1 and Cb2. We have to say that at the moment, and as far as we know, is the most important endocannabinoid, the most abundant in our system. And it does help with inflammation, with seizures. It does help with immunity. It enhances the immunity system. And it has a specific and important relation with the circulatory system and the nervous system. As I said before, there are some other endocannabinoids that we have recently started to discover and to find out how they work and how they interact. And I just want to mention, and that's just a little note to tell you that PEA, which I know many of you might be using, it's considered an endocannabinoid, and it's mainly because it interacts with some of the receptors that nowadays are recognized as cannabinoid receptors. It has special affinity for some of them, and it has some anti-inflammatory effect per se. And at the same time, it increases the ANA effects, so the anandamide effects. That's why it's recognized as another endocannabinoid. We also have the OEA, which is very similar to the PEA, and it does work. It does work in a very similar way. And there are some researches that do state that we can see its amount increase when we are talking about cancer metastasis mainly. So that's interesting, and it helps us to think that there might be some relation with that too. And another one is the NADA or NADA, and it has affinity for Cv1 receptors, and it's an apoptosis inductor. And that's very, very interesting because recently there are more and more researches in regards how cannabinoids can help with cancer, with metastasis in both ways. Not only controlling it, but also producing apoptosis and helping it to heal completely. Now, let's see how it really works. As I was saying before, most of the endocannabinoids products or molecules, they are not stored. They are only produced when they are needed. And what happened is that in the presynaptic neuron comes an action potential, and it does help to start releasing all the calcium and within the synaptic area, and that helps in the cleft, sorry, the synaptic cleft, and it does help to release all that glutamate or all that neurotransmitter that is going to travel through the synaptic cleft and get into the second or the postsynaptic neuron. What happens then is it reaches the second neuron, then the cannabinoids start to be produced. So we can see that once it gets into that postsynaptic neuron and it starts producing, then it's again released and it travels again across the synaptic cleft, but then it goes back, and that's why we said there is a retrograde sort of action, because it goes back to the primary neuron and is capable to regulate in case we need to produce more or inhibit the production and the release of the neurotransmitter. So that's pretty smart, because the thing is, this product, these endocannabinoids, are mainly phospholipids, so they're mainly released and produced and used from the border of the cell, and it helps them to be released as they are needed as soon as the neurotransmitter gets into that neuron. So we don't waste them. We use them only when we need them. And what we do is to produce them in order to control an excess or a deficit of the neurotransmitters. We do not only have two phytocannabinoids. The main ones, and the ones that and I think they're the main ones because they are the ones that we've been doing lots and lots of researches, but that doesn't mean that there are some others coming by, are the CBD, which is cannabidiol, or THC, which is tetrahydrocannabinol. There are some others, as I say, cannabinol, cannabidiol, cannabicyclol. They do have different effects. They do work within the body too, and they do interact with the endocannabinoid system. I think that in the future, we will probably use them a lot more. We will probably know how much they can help, but we are just starting to find out what is going on with them and what we can do with them. But they are there, and it's very interesting to know that some of them can complement or can have different benefits or actions within the body, so that maybe we can combine different ones and get different effects depending on what we are looking for. And that's probably what the future is looking for, how to combine the different compounds in order to reach exactly our goal. And let's talk a little bit, just a little tiny bit, about the THC and about the CBD. See what's the difference. How can we use them, and how do they act with the cannabinoid system? Let's talk first about the THC. The THC is the psychoactive one. We all have heard about it. We know that most of the products are really controlled drugs because of the proportion or the levels of the THC. So that means that we really need to know how it works and what it does in order to be able to use it. So the THC interacts with the Cv1 and the Cv2, and it's partial agonist. It means that it's capable to attach to those receptors very easily. And when it attaches to those receptors, it has different effects. And some of the effects that it has are mainly on appetite. It does have an antiemetic effect, which is very interesting, especially if we join that effect along with the appetite one. It does have some control of the pressure in the eyes. intraocular pressure. It does have anti-inflammatory effect. We've seen that in fact, it does have a very, very high anti-inflammatory effect. It does work on acute pain, on chronic pain. It does help to control spasms. It does help to control neuropathic pain. So when we are looking forward to use the THC, and we know that we have a problem or an issue regarding pain and inflammation, a lot of pain and a lot of inflammation, we might think in a THC as a proper product or molecule to be used. We'll have to know how much we're going to use and how to use it. But the truth is that we can think about it. And also when we have an animal that doesn't have too much appetite, it's not eating very well, he's feeling really, really low, he's vomiting, and he doesn't want to interact very much because he doesn't have any strength anymore. That's a molecule that we can think about. And regarding the CBD, that's the not psychoactive molecule. We have to say that it does help to reduce the THC side effects. So that's a good thing, because as we were saying, we can combine both of them and probably have a better benefit by using them together than if we use any of them alone on their own. The CBD does also have some anti-inflammatory effects, some analgesic effect. It also has some anti-epileptic properties. Is nowadays used in kids with these problems, and is further being used in animals with these problems. It also has some anti-asthmatic properties, which I would love to talk about it a bit later, in order to see how to use it. And it obviously has some anxiolytic effects and some neuroprotector effects. So as we can see, even though one is psychoactive and the other one is not, and even though they might have different benefits, we can combine them together and have a better result within our issues. And if we combine them both in a special way, we can even reach higher goals than if we use them sometimes independently. By saying that, it helps us focus each one of them depending on the problem that we have, and being a little bit more specific of what we want to reach. This is just to give us a little bit of an interest of what can we do with the different cannabinoids. We have here, and this is a very quick one, just to give us a sight of how all of them are different cannabinoids, phytocannabinoids, and how they all have different effects. Again, CBD is the one that has most, mainly because it's been the one that has been more researched and has been studied for a long time, but we can see that even we can have some antimicrobial and some bone stimulant effects on some other phytocannabinoids. And this is very interesting, and that can be part of the future in regards to the use of the cannabinoids. And these are the terpenes. They're mainly found in plants, but they can we can use them by using them the oils like lemon oil or lavender oil or orange oil. And that's very interesting because we have seen that they interact with the cannabinoids, with CBD and THC mainly, but with some other cannabinoids, phytocannabinoids. And they are in the plants. So they do combine, these are the ones that are mainly found in the cannabis plant. But we can also use them, and we can also combine them when we use certain products that are isolated products and that only do have CBD, And when we combine them, we can get certain effects. Like with the lavender, it does have some calming effects that do interact and they do combine with the CBD and the THC. So we sort of reinforce that effect a little bit. Or the pepper, the carophylline, it does have some anti-inflammatory and analgesic effect. So again, when we use this oil or oils that do have carophylline, like the copaiba oil, and we match them together and we use them together, we can enhance a little bit that effect regarding pain and regarding anti-inflammatory effects. And I didn't want to keep on going and telling anything else without talking about the entourage effects. And the entourage effects is exactly what I've been talking about a little bit. It's the combination of these terpenoids, the combination of the flavonoids, the combination of of the cannabinoids, the phytocannabinoids mainly. Um, the combination of all of them is not an additive combination. It multiplies the effect. That's very interesting and it's incredible. We have seen lately that we get a better benefit and we need to use a much lower dose if we use them all together than if we use them separately. And that is what is called the entourage effect. Um, it helps us modulate an overall the overall effects. It helps us to reduce the side effect of some of them, but it enhance or it helps to increase the good benefits of some of them. Um, so yeah, we always have to keep in mind that we do have that entourage effect that is very, very interesting, and that is mainly what nowadays is recommended to be used, mainly to be able to obtain all the benefits from all of them together. And now let's introduce a little bit of the receptors. And here we have to talk about Cv1 receptors and Cv2 receptors. We have more receptors, but those are the main ones. And the Cv1 receptors are mainly in the brain and in the spine, in the neurological system. It's the most abundant G protein receptors, G protein coupled receptors that we have in the body. And that's very interesting because as they are mainly in the brain, that means that the cannabinoid system is mainly going to work in that area, and it mainly can help us with anything that is regulated by the brain, which is mostly everything. It's very interesting also that there are non-Cv1 receptors within the respiratory system. Or in the respiratory center, sorry. And that's very, very interesting because I know that we are always aware of what is going to happen if I do give him a very high dose, or if I increase the levels or the rates that we are using, and can it have any harmful effect on the animal? And yes, the reply is we have to be careful with certain things. But we certainly do know that because it doesn't have any effect at all on the respiratory centers, the lethal dose of these products is really, really high. It's really, really huge. And that's the reason why we can use them, being really, really sure that the side effects that it's going to have is not going to get the animal so low and so down that it's going to be risky for their lives, unless it does have some other secondary problems or some other secondary issues. But in first instance, it's not going to take them so low, like an anesthetic, that they will stop breathing. Those Cv1 receptors do have a mainly analgesic and neuromodulatory effect once the cannabinoids have joined them. And we also have to say that the THC has some predilection for Cv1. That means that it's going to be able to join Cb1 much easier than probably Cb2. And there are two things that we have to keep in mind here. And it's dogs do have more Cb1s than Cb2 receptors. That means that they do more receptors within the brain area, and they're more prone to have the THC effects within their brain, because it's where they do have more Cb1 receptors. And the second thing to say is that we dogs do have more Cb1s in the brain than humans do. Which it means is that for humans, maybe having a little dose of THC is not that bad when they have it on its own. But with a smaller dose of THC, the dogs are going to have more effect on the brain and the secondary effects from the THC. But also by saying that, we have to say that the CBD that helps to control those side effects by joining the CB1s. And it does change the way the THC has to join this receptor, and it controls and it avoids the THC from joining into that receptor. So if we are able to work with CBD at the same time as THC, we are going to reduce those risky or those side effects that we might be worried about. And we also have Cv2 receptors, and they're spread all around the system, especially within the cells of the immune system. But they're everywhere. They're in the muscles. They're in the intestine. They've seen that they are also present in some tumor cells. So as we can see, those Cv2 receptors do have an anti-inflammatory modulation, an immunological modulation, and also an immunoprotector effect. We also have to say that the number of these receptors increases with age. So that when we are worried about what can happen if we give this or we use some of those products with old animals, I would say that because of the response that it has and because of the increased number, is the perfect time to be used, especially in old animals that do start having some issues. And where do we have these receptors specifically? We've said that CB1 is mainly the brains and within the spine. The CB2 is mainly in the immunity cells. But we can see that we have CB1 receptors in the brain, in the lungs, in the vascular system, in the muscles, and also in the gastrointestinal tract and the reproductive organs. And we've seen that CB2 are mainly in the spleen, in the bones, on the immunity cells, we said before, and in the brain, specifically in the glial cells. But that's not it. I mean, it's not only that. We also have a combination of both of receptors within many parts of the body, within many areas, like in the liver, in the pancreas. And that's very interesting because so far there are no medications at all that help to balance and help to restore or to control a little bit the pancreas when it's starting to be having issues. Again, the same with the gallbladder, with brainstem. And that's very interesting because we also have both of them in the skin. We are having issues, we are having problems within the skin, and we are trying to approach all those problems from different points. And maybe we are forgetting that we could be using those two receptors that we also have in the skin, and we might have big difference just by helping on those receptors. And of course, cancer cells. As I said before, we have some other receptors where some other cannabinoids are helping and are interacting. And this is just to have a quick look of at some of them. We have some G protein couple receptors, same as Cb1, Cb2. We do have some receptors associated with ion channels. And finally, we do have some nuclear receptors. And that's a very important place for receptors to be, because as I said previously, those nuclear receptors means that we can even get control to that deepness, to the nucleus of the cell. And it does help us to control what the cells are showing, are not showing, apoptosis, um, um, getting different types of cells, or being able to control what is coming out. And finally, just a little notice in regarding the enzymes. So we do have some degradation enzymes that would work here once we get into the pathway to degrade all these endocannabinoids once they are not needed anymore. Also hydrolysis, and finally transport. It's basic to have some enzymes that are capable to transport the cannabinoids everywhere. And the next idea would be to talk a little bit about when and how to use these phytocannabinoids. Uh, what types of products do we have? When can we use them? What dose? All of those aspects that we are struggling with, that we don't really know what to do or how to do it. Let's go. Let's have a look and see if we can help you. So we've been saying that we have receptors in the brain. We have the endocannabinoid systems that are capable to interact with them and have different effects with them. We have some other receptors within the lungs, within the guts, within the skin, all around the body. So that's a little bit where we can use them. Every time that we have any sort of stress, any sort, either if it's emotional, either if it's physical or if it's physiological, on any sort of stress, this system is designed to balance and to get the homeostasis within the body. So in any moment, we can go ahead and use the endocannabinoid products, the cannabinoid products. So in any case of epilepsy, neurological issues with anxiety, skin problems, respiratory problems, as I said, cancer, specifically in dogs with hip dysplasia, with arthrosis, osteoarthritis. In all those cases, the products, the cannabinoid products, can really, the medicinal cannabis can really help us and can really help them to feel better, to have a better quality of life, and to be able to be around us feeling much more comfortable. And in cats, yeah, we know that we have, again, some neurological issues, some epilepsies, but we can also think in cats with a gingivostomatitis problem that is always an issue to deal with. We do have some Cv1 and Cv2 receptors for inflammation and for pain. And if we do work with this, and we do know that the CBD also has some antibacterial effects. So if we do work with that, it will help them to feel better, and it will help them to be able to reduce the inflammation and to reduce the pain. This is sometimes related with appetite. We do know how picky cats can be sometimes regarding feeling bad and not wanting to eat. So Cv2 or CBD also does have that appetite stimulant, um, especially if we use it along with other components or with other compounds. So that's some other case where we can use medicinal cannabis. we've seen that it does work amazingly, and that it does have some properties and benefits when it does work when we are working with Cv2 receptors, that are mainly immunity. They are mainly working with the immunity system. So in all those cases where we have viral diseases in cats, and that we are at the point where we cannot do very much for them, giving them cannabinoid, CBD, it can really help them to get, again, to feel better and to give them some quality of life. In bone fractures, in diabetes, in cats, it's so interesting the researches that lately have been done on that. That is definitely a must use when we have a cat with diabetes. Behavioral problems, when we have a cat at home and we want to get another little one and make it part of the family. And for those first days, in order to cope with the behavioral issues and in order to be able to get them together, again, the medicinal cannabis is a really, really good option in those cases. So what about horses? There are many, many cases, and as we see, even from last centuries, we can we can use these products in anything related with pain, with inflammation. But it's been used for many years on colicos and allergies. So it's also a product to think about when we have horses with any of those problems. And now, what type of products do we have? We have CBD products or THC products. The products which are high in CBD are what we call the full spectrum or the CBD isolate. The full spectrum at the moment, by law, it's a product that has 97 to 98% of CBD, and the other 2% has some other compounds. And when we say some other compounds, it can mean some other cannabinoids as THC in very small amounts, and some other terpenes. What we get when we use that is we get the entourage effect, and it allows us to use lower dose of the product, but still get a much better benefit. So this is a really interesting product when we are looking forward to have a combination of compounds and looking for a better outcome with all of them together. And the other product is the CBD isolate, which is 99.9% a CBD, which means it's only CBD, okay? And you might say, well, but then we don't have the entourage effect, or we don't have any of the benefits of the THC, which is true. But it is a very good product in case we want to combine it with some other molecules, with some other specific known molecules. Like if we want to combine it with maybe lavender, or maybe copaiba, or maybe frankincense, different oils that we can combine with into it. Not at the moment, but it can even get to the point where you can add a little bit of THC depending on how much you want, so that you certainly do know exactly, or even some other cannabinoids. As time goes by and as time let us understand exactly how they work, like the THCA, which is the acid form of the THC, and it does have a lot of benefits, but no side effects at all. And if we are capable to have that molecule and combine it with the CBD, we can have certain specific benefits from that combination. So the CBD isolate is really good to keep in mind also if we want to combine it with something else. And when should we use CBD then? When should we try and go for those products, a full spectrum isolated CBD? Mainly when we have problems related with the brain, epilepsy, dementia, anxiety or stress, fears or phobias, mainly behavioral issues. Also, and that's very interesting, We can use it when we have respiratory issues. There are lots of Cv1 receptors within the lungs, and it does help to open the lungs, to open the bronchus, and to help the animal breathe much better. So when we are afraid of what we are having in the lungs, or when we have um, um, bronchitis or bronchitis or an issue with the bronchus, we can also add a little bit of medicinal cannabis, CBD, mainly to help with that. Because it does help with behavioral issues. It's very interesting to be used when we introduce new members in the family, when we want a new dog or cat to be part of the family, and those first days sometimes are a little bit rough, a little bit tricky. We can use CBD on all of them, on all the members, to help them calm down a little bit and feel a little bit more easy to go. Um, Also, when we have muscle pain, very localized in a very specific area, mild to moderate pain in arthrosis, in arthritis, where we know it's just in the hip or it's just on that place, on the ankle, just an area, very, very specific area. It's good to be using the CBD. And also when we have sleeping problems, sleeping issues, these all dogs, all animals that are starting to have a little bit of dementia, or maybe they are not at that point, but they start waking up very late at night, calling for us, moving around, um, cats mowing for the entire night because they are not capable to sleep. All those sort of issues, they can be really, really easily handled when we use CBD. And I would also recommend you that you can use CBD to start with in any case, even if it's a little bit stronger pain, or if it's a little bit more overall situation with the animal. Start with it, start with the CBD and see how it goes. And if you notice that it's not enough, that the animal is still on pain, or that the issues that you are trying to control are not being completely controlled, then I would suggest you to move forward to CBD THC 1-to-1 rate. And how do we use it? And how much those do we use? And I like to say that that's what I call a little bit of the art of the medicine, the art of being a vet. Being able to connect with the animal and being able to really connect with the owner, and between the two of you, find out what is the best dose to use. And here we have what we call different levels of dose depending on the problem that we are issuing. We have microdose, which is 0.1 to 1 milligram per kilo. Low dose, which is 1 to 2.5 milligrams per kilo. Medium dose, which is 2.5 to 5 milligrams per kilo, or high dose, which is 5 to 10 milligrams per kilo. And when we use those doses, sometimes we have to keep an eye on side effects, because they might start showing up here. And when I talk about side effects, I mainly mean things like vomiting or diarrhea, or not being able to walk properly, things like that, mainly. Okay. We use those doses every 12 to 24 hours, but we can also use them every 8 hours, or maybe even in between. We can have an animal, and it depends on the situations. We can have an animal that we are working on behavioral problems or behavioral issues, mainly when he walks in the street, because he's a little bit aggressive or responsive with other dogs. So we want him to be a little bit calmer. So maybe we can use some microdose within the morning and at nighttime every 12 hours, just to keep him on a little lower level of anxiety. And we do know nowadays that usually the CBD kicks in dogs within approximately 45 to 75 minutes. So if we are going for a walk and we know that we are going like this evening or this arvo like 5 or 6 p.m., we can try to give in a very, very slightly microdose, like 1 hour before we go for a walk, so that it's kicked in once we are walking and we are trying to reassuring and on keeping him calm, on keeping him feeling better, and not being so reactive to other animals. Obviously, this has to be combined with some other behavioral tips like using treats and some other ways of working with them. But it's just to introduce the idea of the timing. We could also use different doses for night and morning, even though we are using it every 12 hours. If the animal is not having many issues at night time, or just opposite, if we have a dog or a cat that is very, very awake all night and is struggling, or you are struggling to keep him calm and steady during the nights, but during the day it's all right, it's not that bad. Maybe we can use a slightly bigger dose at nighttime and a smaller dose in the mornings. So that's something that, even though you have your goal and you establish your goal, like, okay, let's start giving him, let's give him like 1 milligram per kilo twice a day. You always need to start on a lower dose and increase it slowly and see when we reach the dose that is really helping him or really helping the animal. So, like you might start on a very low doses at nighttime just to get the animal adjust to it, and then start increasing it in the morning and at nighttime, along 5 days, 1 week, to see how he's responding to those levels, to those doses. And you might need to, even if you establish your first goal on 1 milligram, you might need to go a little bit farther, maybe to 2.5 milligrams per day, twice a day. But sometimes it might be just enough with zero point 0.5 milligrams twice a day. So it depends a little bit on the animal. You really need to keep in contact and keep in touch with the owner to know how the animal is doing, so that you can assess what is the best dose to give him. That's something that it's really good if you can keep a pet. The owner can keep a pet journal with your indications on how to follow the animal and what does he need to look for. And yeah, just establishing one goal doesn't mean, or those goals doesn't mean that you are going to reach it. You might stay lower, or you might need to increase it a little bit later. But again, that's the art of the veterinarian. We can use it topically, we can use it rectal, we can use it oral. The main thing is to get in contact with the mucose. So you can add it into the food and you can put it in the mouth, whatever is easier for you. One of the things that we have to keep in mind is, if we use it orally, it's always give it with food. And the main reason is that because it does help with diabetes, it does help to reduce, not to reduce, but to balance a little bit the glucose in the blood. But it's true that it usually reduces a little bit the levels of glucose in the blood. So we want to make sure that the animal has enough levels, that he's been eating, that he has normal glucose levels, and that's why we usually recommend to give it with food. Now it's very interesting because we can also use it for nebulization or vaporization, especially in cats when they're struggling with asthma. We can always use one of those ventilators or with the mask, and just add 2 drops with some saline liquids, and just let him breathe all that air with some CBD in it. And as I said, it's very, very important to do what we call titration. The titration is exactly starting with a low dose within a few days. I mainly recommend you to start at night time, usually on a very low dose, 0.1 milligram per kilo, 0.2 milligrams per kilo, no more than that, for 3, 4, 5 days. After that, I would increase And I would start giving him the same dose, but twice a day, like the same zero point 0.1 or zero point 0.2 milligrams per kilo twice a day. And then we can go further, and that will give them that for maybe 5 to 7 days, depending on the issue that you are dealing with, and depending on how acute it is to start giving him all those products. But if you have time, it's better to do it from week to week, 5 to 7 days. Otherwise, you can try to increase it every 3 or 4 days. Um, so I would probably go to twice a day for 1 week, the same dose that you were giving just at night, but now we'll give it twice, and then increase it maybe to 0.5 milligrams per day. Per day, twice a day, so that we are ending up giving them 1 milligram a day. That's a microdose, but it's been quite helpful, and sometimes you can already see some really good benefits with that dose, so that you can give that dose for at least 1 week again, and then you can assess the animal along with the owner and decide if you need to keep on going a little bit further. Again, depending on the problem, sometimes if it's just behavioral issue, um, or anxiety and being stressed, probably 1 milligram per kilo once or twice a day is more than enough. If you are dealing with an epilepsy or with pain or an inflammation, you probably might need to go to 2 milligrams per kilo twice a day. But obviously, you have to go with the in between dose, instead of jumping from 1 to 2 milligrams per kilo twice a day. It would probably be better to go from 1 to 1.5 and then 2 milligrams per day, because 1.5 might be enough. What happens in regards to THC products? We have two different type of products. What we call the balanced formula, THC CBD 1:1 rate, and we have the dominant THC CBD THC, which has a much higher dose of THC, if you compare it with CBD. So CBD THC in a balanced formula, they're usually 48 to 52%. We have to say that it's a wonderful, wonderful formula to use for animal, because the CBD is capable to control all the side or negative effects of the THC by being able to join the Cv1 receptors, and then keeping the THC from joining them, so that the THC can really go into the Cv2 receptors, join the Cv2 receptors, and have all the good benefits that it has by reacting and joining them. So it's a really, really nice formula to use, especially when you have really high levels of pain, when you have really a lot of inflammation, like when you have an animal that is has been highly traumatized for any reason, or when you have an animal after a very, very strong or hard surgery and is on a lot of pain, or when you have animals that they do have arthrosis, but not localized, but all along the body, like maybe in the shoulders, maybe in the hips, also along the spine, having some spondylitis, maybe even in the neck. So all those sort of animals, they do respond really, really well. And I would really focus on that balance formula. I would also think in that formula when we are dealing with animals with cancer, animals that are feeling really, really sick, they have lost appetite, they are not very interested in life, and they're usually in a lot of pain too. In that sense, or they're vomiting. In that sense, I would really focus into this balance formula. The dominant THC, when to use it, and I would say that that's for very, very specific cases, and I would probably suggest to use that one on animals which are like in their really last stage, like terminal cases, same as we could say in humans. animals which are just on the last days where the owners are deciding what to do or when to do something for them. And it's just to give them a few hours of quality of life. In those very specific cases, I would certainly try to go for a dominant THC CBD product. So when to use it? Again, on any acute and very intense, very high pain. When we have widespread pain in different areas, just not localized on the hip, but everywhere else in the body. When we have hip dysplasia on a very late stage that is really, really inflamed, where it's really, really painful, where the animal can barely walk, or is very stressful for him, not being able to walk, I would certainly go for products with THC. Of course, as I said before, when we have nausea, vomiting, when we are facing anorexia of any type, not only because of cancer of any type, but sometimes they are mainly related with cancer. Not only in those cases, because in cats, we do know that as soon as they get a little bit sick, the first thing they start doing is stopping eating. Um, so I think that in those cases, especially because cats don't have so many Cv1 receptors in the brain as dogs do, it's true that they are much better with THC higher doses or higher levels. So certainly that would be a case where I would use the 1-to-1 rate CBD THC. And also when we are having an animal that is having issues with the muscles, we said before that we can use CBD for epilepsy, but sometimes, depending on the type of epilepsy and how it goes, sometimes it's good to go a little bit further and use some CBD THC product. And what dose? What dose do we use when we are talking about THC? And the dose that we are talking about is mainly 1/10 of what we would be using of CBD is 0.05 and zero point 0.1 milligram per kilo. It's true that we can go all the way up to 2 milligrams to 3 milligrams, but it's very rare that we really need to reach that dose. Sometimes with 0.1 milligram per kilo twice a day. Um, Again, we can go a little bit higher on a higher dose with cats, and maybe even go to 1 milligram per kilo or 2 milligrams per kilo. But if we keep doing exactly the same titration as I recommended in CBD, it means start on a low dose, maybe at night time, see how the animal goes for 4 or 5 days, and then start using it also in the morning and night time, and again, working it out. We can also do a little bit of timing in here, and adding a little bit of CBD in between if we want. Like if we have an animal that is very, very, very sore, and we are using a product which is 1-to-1 CBD THC every 12 hours, and we are walking him daily in the afternoon, we can still add a little bit of CBD, and that would be just CBD, because we have to keep in mind that with the THC is the limiting factor, but we can add a little bit more of CBD in between in case we need it. So we would add that CBD in between, and then after an hour, go for a walk with the animal, which would be a little bit less painful for him. Um, Remember, as I said before, that cats are a little bit less sensitive to THC. And I know that we are always worried of using THC, but keep in mind that as long as we are using THC with the CBD, the CBD is going to be able to cope and to control most of the secondary effects of the THC. Also remember that the lethal dose for THC, the lethal dose for THC is over doses of 3,000 milligrams per kilo. So we are talking on very, very high levels, on very, very high doses of THC. And we are not going to be using those doses in any case at all. So finally, and that's a little bit of trying to make a resume. First of all, um, if you can choose between isolate or full spectrum, always try to use full spectrum. You are going to get better results, and you are probably going to need to use less dose, lower dose than if you use the isolate. Unless you want to add your own oils or your own molecules into that isolate. But if that's not the case, I would recommend you to use the full spectrum. What do we do with the THC products? Full spectrum included, because full spectrum might have a little bit of THC. Start low on low doses to get the animal settled, to get adjusted to the dose that you are giving him. Go slow, increasing. And when we say keep low, is to keep at the dose that you see that you have the benefit or the effect that you were looking for. There's no need to give any more dose if you are already having the benefit that you're looking for. Okay. So just keep that in mind, especially again when you are using the THC in a balanced product, that the THC is going to be your limiting factor. Um, Also, yeah, just remember that you can add some essential oils or some other cannabinoids into the isolate products, into the isolate CBD products, so that you can get certain benefits, or when you are looking for certain properties, you can add and combine those with the isolate CBD. And just a note to for you to be aware that we have some terpenes within the full spectrum, and some oils and essential oils do have some terpenes that cats might be um, a little bit too reactive today to them, let's say that way. So just keep in mind that when you're using full spectrum, or when you want to add some essential oils, um, you have to know what you are doing. In full spectrum, it's really a very, very, very rare to have any problem with them, because it's true that because we are using just 2% of some other compounds, the level of terpenes that we are adding into the full spectrum is just so small, so tiny, that in my experience I haven't seen any problem, and many other vets that I do know that are using them haven't had any problem at all. But if you're going to use the isolate and add some essential oils into it, and you're going to use it for cats, just keep in mind and be aware that some cats can be a little bit too reactive, and you have to know exactly what oils you're using and the amount that you are adding. Finally, that's a really quick look at dosage horses. In horses, just keep in mind that they're very, very sensitive to THC. So you might mainly work with them just with CBD, and probably isolated CBD in this case. Um, and usually the dose that is used is 0.25 to 0.5 milligrams per kilo, usually every 12 or 24 hours. And you usually use slightly high doses on the first 3 4 days, and then you can reduce it, and yeah, just even stop it when you don't need it anymore. Now, I want to talk a little bit about what's the interactions, or what are the secondary effects that we can have, or what are the problems that we can have if we are using some other medications. And this is a little bit the same for many of the drugs. Um, THC and CBD, both of them are have certain metabolism related with the cytochrome P450. So we have to keep in mind that any medication or any drug that is being metabolized by this same cytochrome P450 is going to have some sort of effect when we are using the THC and CBD. The main, or the most known case is when we are using blood thinners, either warfarin or others. It's true that we don't use them very much in animals, just the opposite. We usually are careful with them. But in any case, if you are using them and you also want to add a little bit of THC and CBD, you need to know that you have to monitor that animal very closely and be very sure of how much you're giving him and what is going on within the bloods. So that's something to keep in mind. Also with phenobarbital, because we are saying that we can use it with animals that are epileptic or that are having epilepsy seizures. We can use it along with the phenobarbital, but because of that interaction, um, we are going to need to reduce the dose of the phenobarbital, because otherwise the phenobarbital is going to be too long within the system. It's not going to be metabolized properly. And at the end, the result is going to be that we are having too much dose of phenobarbital within the body. So within the bloodstream. So when we are combining both of them, the first thing to keep in mind is not immediately, but once we reach the dose that we are looking for to give with the CBD, I would start reducing the phenobarbital as soon as possible, and then reassess what's happening and what is going on within the next 2-3 months. Either checking the dose of phenobarbital, even checking obviously the signs of the animal, obviously the liver signs and all of that. But we will certainly need to reduce a little bit the dose of the phenobarbital for sure. Now, there are some other drugs that do interact with CBD and THC too, like some antifungal, like the ketoconazole, or some antibiotics like the macrolides, some cyclosporins, some antihistamines. So all of those products, they interact again through that cytochrome P450, and it makes us have to reduce the dose or the time when we administer CBD and THC. So if we have an animal with this having CBD and on a long term, and we need to give him some antibiotics or we need to give him some antifungals, we need to keep in mind that we have to reduce the CBD dose, lower it a little bit, or if we are using it every 12 hours, maybe we should give him just CBD for 1 week or for 2 weeks for the time that we're using also the antibiotic, just using it every 24 hours. Because the metabolism of the CBD THC is going to be reduced. And again, it's going to happen the same or very similar to the phenobarbital before. We are going to have the CBD and THC working within the system a longer time and longer doses. Thank you very much. I hope it helped explain a little bit more of what the endocannabinoid system is and how it works and how you can use it to help your animals. And please, we are going to have lots of tools to help you work with them. And we would be more than happy to get in contact again with you and talk about any issues or any concerns that you might have. We are here to support you, to advise you, and to be by your side on any step of this new world that we are reaching regarding the endocannabinoid system and the phytocannabinoids in animals. Thank you very much and see you soon.